Welcome back to the Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes.
What if innovation didn't mean more complexity, but more connection? In this episode of The Exam Room, Dr. Rhiannon Winsor sits down with Christian Milaster, digital health consultant and founder of Ingenium, to talk about what innovation really looks like for health centers. From practical telehealth to culture change and clinician buy-in, this conversation is full of real-world strategies that go beyond theory and straight to the heart of better care.
Welcome back to the Exam Room. I'm your host, Dr. Winsor, and today we're joined by Christian Milaster, the founder of Ingenium Digital Health Advisors, a recognized expert in digital health and telehealth innovation. Christian is a consultant, keynote speaker, and strategic advisor who's helped countless organizations accelerate their digital transformation. He's been named Consultant of the Year and was recently inducted into the $1 Million Consulting Hall of Fame. Today, we'll be talking about how health centers can adopt digital innovations faster and smarter, not to only survive the current wave of change, but to truly deliver extraordinary care. From website manner to care team engagement to practical change management, this conversation is packed with insight for FQHCs navigating the future. Christian, before we dive into today's discussion, can you tell us a bit more about your journey and what inspired you to start Ingenium Digital Health Advisors, and what drives your mission to accelerate innovation in healthcare?
Thank you very much. That's a whole loaded question, and I guess that's why we have a full podcast or two to talk about that. So thank you for great to be here in the exam room, on the exam table, I guess, to be examined about my perspective on innovation. My background is I'm a German engineer, and I've been in the US for 27 years, and I stumbled into healthcare at the Mayo Clinic in the year 2000 and really became fascinated with the mission of healthcare, and then decided a few years into that really is my career and my calling. But as a German engineer, we love to improve things. We optimize things. We like them to make them as efficient and effective as possible. And boy, oh boy, are there opportunities in healthcare to improve efficiency and effectiveness. And so what really inspires me and drives me, what keeps me going is the mission of healthcare that I was inspired by at the Mayo Clinic. The needs of the patients come first. What I quickly realized is that the physicians, especially if we go back 25 years to the year 2000, right, that was the early age of EHRs and EMRs, and physicians were given these dinosaurs of technologies that were inserting themselves squarely between them and the patient, and they were being told, here, use this drop-down box, use these 17 screens to record what you did so we can bill accurately. And physicians rightfully were incensed, and I had a lot of conversations with that. And I, as a software engineer, was shocked and appalled how this bad technology was put into clinicians. It was getting in the way of really great care delivery, of great service delivery. And so my passion is to enable the delivery of extraordinary care. I want to help clinicians to work in workflows, to work with systems that are optimally configured and designed to really help them to focus on the patient interactions, on helping the patient to understand their diagnosis, to help them, to get them engaged in participating in their care and give them the answers they need or the confidence that they need without the workflows and especially the technology standing in the way. And so in 2012, I had an opportunity to leave the golden handcuffs behind of the Mayo Clinic and start my own consulting firm to work with organizations who wanted to move a little bit faster than an academic medical center. So that's what's driving me. And to the last part of your question, underlying all of this is it's all about innovation. And innovation is just, right, it has the word novel in it. So it's about doing something new, that hasn't been done before. And there's so much innovation out there in terms of different management approaches, different workflows, but a lot of innovation in digital health technology. And so the core expertise of our firm is helping organizations to take any kind of digital health technology, whether it's telehealth, video visits, RPM, or AI, and how do we integrate that particular technology into the workflow, into the care experience, so that physicians can practice on top of the license, doing only the things that only they should be doing, and everything else is being taken care of. And so that's when I realized it's healthcare is historically very, very risk averse, and rightfully so, because we're dealing with patients' lives here. But with that, we are also we're very averse to adopting innovation, doing something new. And we unfortunately can no longer afford this as a system. We have to be innovative. We have to look at things, and we have to do it safely, but we also have to do it quickly.
Yes, absolutely. And you kind of answered my first question that I had. To me, innovation is utilizing existing resources in a new way. Maybe you could expand on your definition of innovation. I think you touched on it a little bit, but maybe a little, expansion of that for our listeners.
Yeah, there's really three ways of innovation, right? One, and that's the one that you gave me, is my favorite form, is taking something that worked somewhere else and then applying it to a new environment and doing so. I mean, that is definitely a proven form of innovation. I remember 20 years ago being on a workshop at the Mayo Clinic with Disney, where Disney was teaching Mayo on how to do a better customer service and create a better patient experience as they are descending onto Rochester, Minnesota, in the middle of a cornfield, and have their 3-day Mayo experience, seeing different providers to help figure out what's wrong with them and what to do about it, right? So that was innovative, right? Innovative is to take a Disney experience and apply it to the healthcare experience. The other form of innovation is that you're creating really something new. It's continuous improvement. You look at a problem, you look at a challenge, and you say, how can we think about this in different ways, even like it's never done before, right? So it doesn't have to be based on something existing. That also, I think, is a form of innovation. The focus of my work and our work is really on innovation adoption. A lot of the health systems we're working with are FQHCs, are rural health clinics, behavioral health clinics. They don't have the luxury of a donor that gives him $100 million to establish a center for innovation to come up with new and clever ways. And so innovation is really, from a pragmatic perspective, especially for the target audience of this podcast, it's about how can we quickly scan innovation, find innovation that solves problems that we have, right? We don't have to reinvent the wheel just for the purpose of reinventing the wheel if nothing's wrong with the wheel, right? We have a lot of problems. And so really, it's about figuring out what are some new ways or different ways even of doing things that solves our problems. And that, for me, is innovation adoption kind of defined.
Absolutely. Thank you so much for that. And it's not new to us that the healthcare landscape is always changing, and it seems like that changes at a faster pace these days. Why would you say that it's so critical for FQHCs right now to start thinking about this concept of innovation and leveraging it?
So in order to react to the challenges that are being faced today, we have clinician burnout, we have workforce shortages and clinician shortages, we have increasing scrutiny of the FQHC business model. We have potentially a loss in some Medicaid insured people. We do have to do more with less, right? We have to optimize what we have. And so I think the only way to do this is, yes, you can gradually, incrementally improve, or you can improve through leapfrog moves. Now, if we have time, and then we can gradually change over time and make the change smaller and more digestible and more acceptable. But if we don't have the time, then we need to jump very quickly. We need to react to it. So that's the one aspect, is just the numerous challenges that FQHCs are being confronted with. The other one is that healthcare consumers have choices. Now, those who are seeking the care on the sliding scale, or those who have Medicaid or Medicare insurance, there's a healthy part of any FQHC's business model that are people that are choosing to go to the FQHCs because it's convenient and because it's good care, and they're full paying members, so to speak. And so they make the business model of FQHCs work. And we need to attract them and we need to keep them. We need to offer them something that they have access to, different ways of receiving care, different ways of managing the chronic diseases. And so I think all of this for me points to using innovative strategies, novel strategies that are proven somewhere else. Because if we don't, the health system down the road, who has a lot more resources, they will do it. They will offer up virtual care, and most of them do. Then we have all these other organizations, the private organizations like Amazon Care or Best Buy Health, that are also offering up, that are looking at the whole healthcare market as a lucrative market, and they're going to be siphoning off those clients that FQHC so desperately need to make their business model sustainable. And so that's why I think this time is more than ever a time where you really need to retool your whole leadership team, your whole executive mindset, and your whole workforce to do something that one of the Mayo brothers has said, repeating from one of the Greek philosophers, is that the only constant is change, and that everything will change always. And that's, you just have to build a culture that embraces, welcomes, celebrates change, and just says, hey, what are we doing this year? Bring it on, because we're ready for it. We have the tools to deal with the change, and we're no longer stuck in holding on to the things that we know.
I heard you mention AI as one of the innovative trends. Are there other trends that FQHC should be paying attention to?
It's just starting with the basics, right? So video visits, remote physiological monitoring, secure messaging, and exploring value-based care, right? So those are, I think, the key elements. Those are the table stakes these days. And if you don't have them, go look out for fancy technologies. I think there's a lot of opportunity. Again, it's not my core expertise, but with regards to the financial sustainability. So I think on the billing and revenue cycle management, and there's a lot of innovation out there to really squeeze, unfortunately, the last dollar out of the services we provide to make sure we get paid for the value that we provide to the population. And so use that. Again, I focus on care delivery, not on the back office, but that's definitely an element that when we talk about innovation, it's the same thing. There's a different way that people need to enter information, consume information. So yeah, I don't think there's any specific technologies for FQHCs that stands out, and nobody should go out and looking for, hey, what can we do with AI? It's like, what is the problem we're trying to solve? What solutions are out there? And any solution these days has some embedded AI that is leveraging to increase its efficacy for the users.
Yes, I like what you said about, not being able to group all FQHCs in one box. Recently, we interviewed Jessica Yanow from the Arizona Alliance, and she said, once you've seen one health center, you've seen one health center. Right. And I think that's so important that we recognize that they each have their own unique individual things that they're trying to solve and improve, and not to just grab some sort of technology that's like this newest wingding, just to say that they have it, but to really focus on the areas that they need to improve. And I know a lot of health centers are utilizing AI to help with the billing and coding.
And it doesn't have to be about technology either. Innovation does not mean that it has to be technology. There's one FQHCs, which is in the southern part of Ohio, kind of the birthplace of the opioid epidemic, if you've done some research on that. And the CEO there had this really great idea together with his team to open up a pain clinic, but not a pain clinic with prescriptions like it's done in the past, but with a chiropractor at its core. right, to early address chronic pain. And so they added a chiropractor to their service offerings, just like many FQHCs add dental to their offerings or school-based health center support. And so that's an innovative idea, but that is change. It's different processes, different billing, different marketing, different leadership, different skill set, different integration of the service and referrals from the primary care or from the behavioral health side to this pain clinic. And I think that's a really great innovative idea, but that also requires the same set of change management efforts. So an investment in innovation is not about an investment in technology. It's about an investing in changing the culture and the mindset and the capabilities of the team to deal with new ideas in a more rapid fashion.
Customer service is one thing I think we could definitely do better in healthcare. I'm curious to know what your thoughts are about some innovative ways that maybe, and fairly easy ways that health centers could leverage innovation to improve their customer service.
One spontaneously came to mind is a secret shopper, right? When the CEO or the executive director could ask a family member to be a secret shopper and to actually go through the experience of becoming a patient, requesting to be seen, and really testing the experience. Case in point, my wife had a telehealth video visit appointment with a large academic medical center on the East Coast. Right, we showed up, logged in, did the e-check-in process, and then sat there for 30 minutes. And nothing happened. After 20 minutes, sent a message, no response. Turns out that the provider was 5 minutes early, logged in, didn't see us, and then logged back out without asking or notification. Right? That's a breakdown in process. And again, innovation is one thing, but it needs to be anchored in the systematic way that innovation is rolled out to really make it sustainable.
I love the secret shopper idea.
Yeah, so with a secret shopper, you have to go through and actually experience the customer experience firsthand. And obviously the CEO can't do that themselves or the leadership team, but so you can find somebody who does it on behalf. And you would tell the organizations that we're launching a secret shopper program, right? We will have some people that are pretending to be patients. People would say, "Wow, that's a great idea. Yes, we love this. Bring on the challenge. Right? We want to demonstrate how good we are." If you have not so good a culture, people are like, "Oh, we're going to be tested, and what's that going to be?" Right? And so again, if you have that latter culture, then probably you have some other things that you can improve on before you launch that kind of idea. But yeah, you have to do it transparently. You have to do it out in the open, and you're not going to tell them who the person is. but for the next 6 weeks, they're going to be on their toes and say, "Is this a secret shopper?" What's that effect where the behavior changes once you've been observed?
Yes.
The Hawthorne? No, not Hawthorne.
Yeah, Hawthorne. Yeah.
Is it the Hawthorne effect? So the Hawthorne effect, right? So the system will already improve because they think, so you immediately even have to do a secret shopper. It's just you up that. But it's also, again, healthcare historically has been optimized and designed around the clinician, and rightfully so. In no other industry is the most educated, the most expensive resource, the person that is actually creating the value for the organization. In all other industries, it's lower paid people, lower educated people that are actually generating the value. And healthcare is so different. And with that, historically, we had this conundrum that we had to accommodate the special wishes of the physicians because they're our most valuable asset. They provide the care, and that's only they can do it. It cannot be easily replicated. But that has created a dynamic that is not always focused on what's best for the patient, because oftentimes it's what's best for the clinician. I have seen this anecdotally in some FQHCs. Again, if I've seen one FQHC, I've seen one, but I've seen it in multiple FQHCs where the leadership team is afraid of the clinicians, or they're afraid to lose the clinicians if they impose too much of them or if they ask too much of them. And the clinicians know that. Finding other ways of figuring out what's in it for me which then goes to the softer sides of innovation, adoption, and change management, to really find those the triggers and the value, and having a frank conversation. It's like, hey, we need more flexibility, and what can we give to you in return to find that common ground. But that takes a strong executive leader to build out that courage and that communication skill to really stand on level ground, on peer level ground with clinicians.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.